You might think measles is a disease of the past, but it is making a comeback, in large part because of the anti-vaccination movement. There have been outbreaks of measles in a number of places, from New York City to British Columbia, where the origin has been traced to a community in which many kids don't get vaccinated because of religious beliefs. Our health specialist, Dr. Zentner, joins me now. First of all, remind us what measles is, how dangerous it is potentially.
So I want Canadians to remember that measles is more than just a virus that causes a rash. For example, for the 14 days that you're infectious, 5% of people will develop serious pneumonia associated with measles. It has a mortality rate of 1 to 3 per thousand, and about 1 in 1,000 kids exposed to measles will get encephalitis or an infection in the brain.
So it's potentially serious.
It is a potentially serious virus.
Now, we know that some parents don't get their children vaccinated because of fear of side effects, perhaps misplaced, but fear of side effects nonetheless, and for religious beliefs. They have a right to say no. Correct?
You know, Donna, I think patients have the right to make an informed decision, and I'm a scientist, and the science shows that vaccinations save lives. The problem with the measles, mumps, rubella vaccine is that the science that was originally published in 1998 in The Lancet was actually false. So there was a whole, for example, retraction in 2010 showing that the doctor, Dr. Andrew Wakefield, who published this study suggesting a link between measles and autism, was actually fraudulent in his claims and had a financial interest in the whole case. The case was retracted, and an overwhelming amount of data since then has shown that there is no causal link between the vaccine and autism.
And from a medical perspective, what's your concern if a chunk of people are no longer being vaccinated?
So this brings up the concept of herd immunity. So if I'm vaccinated, and if 95% of the population is vaccinated, for example, against measles, then if you're not a vaccinated kid, you're pretty safe, because my vaccination is protecting you, so to speak. But when those rates drop below, and for example, in the measles, it's 90%. For other viruses, it can be less. When vaccinations rates drop below that, you're looking at potentials for outbreaks for things we haven't seen in decades.
Well, and we're talking about measles right now, but there's a potential, I guess, for the resurgence of other illnesses as well.
Polio, smallpox. The 50s can come back to haunt us, and I think that this is something that the population needs to consider when it's looking at the risk and the benefit and what the science shows.
All right, Dr. Zentner, thank you.
Thank you.